because I'm going to go into some specifics. What you can do, depending on the family, what treatment options are out there, and what have been proven to work for certain families. I'll talk about that. All right, so we talk about the lymphoma. The root words for the word lymphoma are the Latin word lympha and the Greek word oma. And we talked about the different types of lymphomas. So these are tumors, cancers that arise from pigment-producing cells known as melanocytes. Melanomas typically affect the skin, but can also occur in other tissues such as the eyes and mucous membranes. And these are cancers that affect persons who don't have, last week I saw somebody who is an albino, and she is here in Jamaica, and she was in the sun a lot because of the nature of her work. She was in the sun a lot, and now she has these cancers all over her body. All over her body. She has bumps, little tumors that come up and bleed. And as I said, there are very effective herbs out there. And depending on the type of cancer, depending on where the cancer is, that is going to determine the treatment options. So let's look on staging of cancers. Staging is a crucial part of cancer classification as it helps determine the extent of cancer spread within the body. The most widely used system for staging is what is called a TNM system, developed by the American Joint Committee on Cancer. And so we're going to look at the TNM. In this system, T stands for the size and extent of the primary tumor. So what is the size? They'll measure the tumor, the primary tumor, the one that was the first one, the one that started first. They're going to look on the size and the extent of the primary tumor, and there's T1, T2, T3, T4. So they're going to determine, one, the size of the primary tumor, whether it is T1, T2, T3, or T4. Next, they're going to look on the N, and the N refers to the number and size of regional lymph nodes involved. So now that you have the tumor, they're going to look at how the tumor is impacting or how it is affecting the regional nodes in that particular area. So if it is in the breast, they're going to look on how is the cancer affecting the lymph nodes under the armpit, or the lymph nodes under your chin, on your neck, or the lymph nodes in your groin. All right, so they're going to look on how the cancer or the lymph nodes that are closest to the primary to the tumor, how it's being impacted. M indicates whether the cancer has metastasized, right? Or metastasize is another name for spread. J.M. Masters says, Miss, does cancer cause cold hands and cold feet? It can, depending on the type of cancer. So the M indicates whether the cancer has spread and spread to distant organs. Then they have what is called MO for no metastasis, and they have M1 for metastasis. So basically, using these three criteria, they are now able to determine what stage cancer you have. So remember, the first thing you want to find out once you hear that you have cancer or someone has cancer is you want to find out the family that it belongs to. You want to find out the stage. Once you find that out, then you are on the road to now looking at how you're going to deal with this. Staging helps doctors determine the prognosis and plan the treatment approach, such as surgery, radiation, chemotherapy, or immunotherapy. The cancer stage is usually assigned a number 1 through 4 based on the TNM's categories, which with stage 1 being localized and stage 4 indicating widespread metastasis. So localized means that the cancer is in a contained area. Meaning the cancer is in a contained area. You have the cancer, but it is in a contained area. So when I spoke to you about plan of action, if the cancer is in a contained area, in most cases, surgery is the best option because you can cut it out. There are other factors to consider, but if you hear that it's good night, True Talker. If you hear that it's stage 1, it may be good to just cut it out. Of course, there are other factors to consider, and your healthcare provider will guide you as it relates to those factors. And stage 4, all stage 4 means is that the cancer has spread to other organs or other parts of the body. And so what now has to be involved is what is called a systemic approach because it's not localized. So you have to use a treatment that will affect the cancer wherever in the body it is found. So usually when you're putting a treatment plan together, usually when it's stage 4, depending on the type of cancer, usually you have to have what is called an integrative approach or a multi-prong approach. And a multi-prong approach may include nutrition. It may include direct approach, and as well as a number of other multiple approaches. So that is something that you're going to discuss with the healthcare provider. But staging is very important. That is the reason why these are the 2 things that you need in order to know how to proceed forward. What family it belongs to, what stage is it at. Do I have time, or don't I have time? If I have time, or if it is advanced, then I know that I need to find a way to slow it down. The first thing I need to do is to buy time. Then you have to also look at the factors of where the tumor is. Is there pain involved? Is the person sleeping? Because if the person is not sleeping, then the person can't heal. And if you're going to deal with the pain, preferably, what is the most natural and effective tools that I can use to ensure that I'm sleeping and also slowing the growth of the tumor? So there are a number of factors to consider.